So here we're going to be learning about our putty system for the polyvinyl siloxane, or PVS or VPS. Some offices may go by that also. But we're just going to look into it for being able to taking a preliminary impression for making a provisional crown or a temporary acrylic crown. So we're going to look at our putties. We're going to make sure that we have two different canisters, one that has a base and the catalyst sign on them. They're usually different in color, and when we open them up, you'll see that we'll have a whiter one or a bluer one, which we'll use with our blue scoop, and a white one that we will use with our white scoop. So going into there, you're not going to need a lot for our application if we're going to be taking a single tooth impression for, say, our number 8 tooth or a tooth in the posterior. Some offices or doctors may want you to take a full quadrant impression to be able to make your provisional crown, but for these purposes we're just going to not need much at all. I'm going to take about a half scoop of one material and the same amount for the other, and always place your caps back on your materials when it is not needed to not risk any spill or evaporation of our products or contamination. So taking our two materials, gonna just have them ready, usually ready for when our patient comes and we need to take a look at their existing condition of the tooth. Sometimes if the teeth are broken, you may not want to take a impression of a broken tooth because your temporary crown is going to come out looking like what you took an impression of. So go look at the condition and assess if this is going to be the correct method or pathway that you're going to take, or you may need to use a prefabricated temporary crown. Taking a look at the teeth that we're going to be using for today. For example, we're just going to be taking an impression of our front tooth for our number 8 for a mock RDA number 8 fabrication. So we're going to look at it. It looks like the tooth's normal. There's no cracked portions or missing walls. So this is going to be a good tooth to impress. So at which point you looked at the tooth, removed any debris that was on the tooth or cleansed it. You're going to take your two putties and you're going to mix them together to create a homogeneous colored putty in the end. Since we have white and blue, we're just going to fold it into each other, really smash it in, and you'll notice that we'll start getting a lighter blue color. And what we're looking for is a homogeneous single color. If I look at my mix right now, it's getting there, but I'm seeing areas where I still have white. So we need to make sure to mix that. Like rolling it, smashing it together, rolling it. Going in that method, you could also just using your thumbs to manipulate it and smashing the whole bit, but rotating our whole mixture. Now, if I was to roll this in a ball and smash it, I should have a nice singular homogeneous color. So this is going to be useful for taking our impression. Going over here to our patient that we're going to be using as an example. We're going to be, put this over here a little bit. We are going to roll this up into a ball. Identify the tooth that we're going to be using, and I'm going to gently take that impression, roll that over the tooth. I don't want to push down on the incisal edge at all. I'm just going to put it on the tooth, and I'm going to gently roll it over the palatal surface and the buccal surface up to the vestibule as much as you can. You don't want to forcefully push too hard on the incisal edge. Also, usefulness of this material is, say down the line in a couple of days the patient does break their temporary crown. All they have to do is come back in. We should still have their impression saved, stored, and named to the point where we can use the same impression from that day to recreate another temporary crown until the final restoration or final crown is ready to be cemented. It's a useful way to be ready in case any of those incidents may happen, which is a very common thing. People don't listen to our instructions possibly, and they'll chew that Jolly Rancher and it'll come out, or it'll crack in half, or they might just end up not having it in the morning because when they're sleeping and their tongue rubbed up against it, it may have been too rough and they flicked at it too much where it came off. So we just have to be ready to be able to remake it, and it's nice to have an image of what it used to look like so that we can make our jobs a little bit easier. I'll bring this down a little bit. So after some time, you may keep feeling it and you might be wondering, well, when do I take this off? Well, you can do a little bit of checks right through your glove. If you have a little bit of a nail that protrudes out, you can just try to stick your nail's impression gently into the material and it may stay there, and that's what we want to identify. If the impression of your nail still stays there, then it's not ready yet. But if you see that you just push your nail in a little bit and the impression bounces back and doesn't leave a little ditch there, our impression material is either finished or right about to be to the finishing point. So when I make my little indentations with my nail, my impression material is bouncing back, telling me that this impression material is just about near completed or finished. You don't want to take it out too early. If it's still going through its setting process and it's still trying to solidify or keep its form, and you make any sudden changes to it, it won't be an accurate representation of the tooth that we took. So be gentle with it, take your time. Usually, because this is going to be in an actual patient's mouth, the heat that's going to be coming off them is going to help set up some of our materials that we use in the dental office. So after a bit of time, usually about 2.5 minutes or so, we should have our setup finally completed, and we're going to remove it from the patient's mouth and looking at our restoration. You don't want to forcefully peel out the impression. It all should come out just like when you take alginate impressions in a one singular motion. I'm able to just pull it out just as so in downwards motion. Being able to look into there, we'll be able to see which tooth is going to be our preliminary tooth that we're going to provide a provisional restoration for. So I just have to identify when I look in there that it is tooth number 8. And with tooth number 8, now I can identify which tooth I'm going to be placing my material into. Sometimes you may want to have a little indicator that will show that that's the tooth I need to put my material into. Some people that are in a hurry may not recognize it, especially when it comes to anterior teeth. If they're in a rush, they may not be able to say, oh, that's the tooth, and may put the material in the wrong part. So you can make your own little indicator, have a pen or a Sharpie or whatever, and you can mark that tooth so you know that this is the tooth that I'm going to place my material into. So I just use little indicating markers. Another thing that you could do is using a barbed Parker or a lab knife, you can take a look at your material and you can trim away the excess teeth that you might not want to see in your impression. Usually a smart way to go about this is to not trim too much. So I like leaving about a half tooth of the neighboring teeth in the impression. So I have little landmarks to be able to place this impression on. So taking your lab knife or your Barbed Parker, you're going to gently go and trim right down into your material. I'm going about halfway into my tooth. Do the same thing for the facial. I'm going to meet myself about halfway. I'm going to do the same thing for the opposite side. I'm going to go right down the center of that number 9, so I can still use it as a guide when I go to put my temporary material to my tooth. So now that I got that cut from the adjacent teeth from number 7 and number 9, you can use your lab knife or Barbed Parker to take a little bit of the vestibule area off if you'd like, or a little bit of the palatal. You still want to leave some room just so that you can have a seal going to the tooth. So I recommend just leaving a little bit behind, but you don't need it to go all the way up to their frenum or up to the roof of their palate. So now I have a nice section square piece. I have a little guiding markers for my 7 and number 9, and I can still use that to place my temporary. The nice thing about doing this and having it nice and trimmed is that I'm specifically looking at that one tooth, and if there's any excess material that gets pushed out from that tooth once it's been overfilled, then I can use my instruments or whatever I need to peel off any of the excess from the palatal, facial, or the interproximals area. And that's how we would use a PVS putty material for temporary crowns fabrication. So now going forward in time, say that we've gone through the preparation process for the tooth and it has been properly prepared. We replaced our working tooth with a prep tooth that has been prepared for a crown using our preliminary impression from before. It could still fit onto that tooth, but now we have some space in there to use our temporary material. Now that we're going on to actually making our temporary crown, we're going to need a couple items to be able to get to that next step, such as an impression gun, or what we're going to be using it is to extrude our temporary material onto. We're going to need the proper mixing tip for our material, and here we're going to be using Temp, but your offices may use any other versions of temporary crown material. Now this one is a shade of A1. You want to make sure that you identify what type of shade that person's going to need so that you don't place a really bright or dark crown in a mouth that does not match that. I'm also going to have a paper towel nearby because I'm going to make sure that this next step is properly done. Alright, so going forward, now that we've noticed what we need for this next part, we're going to look at our impression gun. So looking at it, just has a normal handle, we call this a trigger, and then it has this back part. It has a locking portion on the top to lock our cartridge in, and if we look right down the center of like the barrel, we have a larger hole and a smaller hole. We need to identify those parts because when we take our material, we also, down at the bottom, we have a larger hole and a smaller hole. So they should match. So once we match that, we'll know where it's going to be going in. Now, if you were to put it in incorrectly, it won't be allowed to seat properly. So we need to identify also that there's a little wave portion that's right here that divides these two holes. That also allows for this to correctly fit into this and lock down properly. So before that, let's look at many situations that we're going to have to deal with where, looking at this gun, this back portion for loading is ended up pushed out or extruded. To reset that, we have this little button right here that we simply just push up, and when we hold it, usually I do it with my thumb, I'm going to hold that, pull back until it's all the way receded into the impression gun, which will then allow us to properly seat down and lock our cartridge into our tray. Now, an important thing when it comes to anything that's going to be used that has a cartridge is to bleed the cartridge before use in a patient's mouth. So what we mean by bleeding is I'm going to take this little tip off, or this cap off. It has a specific way of coming off. You can't just forcefully pull it out. You need to rotate it, and then at which point it will pull off. There's a nice little layout to this cap. There's going to be a spiky part right on one side, and this other side is going to be smooth. This allows this cap to go in only one way. You have to look at your impression cartridge or your temporary cartridge and look for that spike where it will get placed into. Now, once I have that, always save the caps, put them off to the side where they're going to be safe. And I'm going to take my paper towel and I'm going to bleed my cartridge so that I can get rid of any of the separated material that has been going on inside any cartridge that we have. So I'm going to slowly pull back on this trigger to bleed out my material. And usually the first part, when you bleed it, it may be runny. So I bled my material into this 2x2 or your cotton tip or your cotton roll or your paper towel, and this is just going to be thrown away. I wanted to ensure that this was properly ready for our patient. At which time, remember on our tip, it had that little spiky part that went into this cartridge. This also, the mixing tip, has a spiky part that will fit the same. Line that up. It should drop in. Once you do, make sure it's nice and flush. And you also, at this point, want to lock it by rotating it till it locks out. Test that you locked it in properly. Try to pull it out and ensure. Because if you try to extrude it, it will force a little bit of pressure onto this tip and it will just push the whole part out. Which if you're working with someone and you're taking their impression, you don't want the tip to fall out potentially into their mouth or making a big mess when you're trying to fill up a tray for the impression. Now we have our material ready. With this mixing tip, it has these little spindle-like pillar that's inside that's going to help with mixing the two materials from the larger barrel to the smaller barrel. So when it comes out of the mixing tip, it's properly mixed and ready for use in whichever procedure we're going to be doing, which for this one, we're going to be making a temporary crown. Okay, so now going back to our tooth, we have our impression gun assembled. We don't want to push down the trigger yet until we absolutely need it, because once it starts mixing inside of the tip, the material will start to harden and that tip will not be useful for us. So before we even start putting this impression material or the temporary crown material onto our tooth, we're going to want to have a separator for our tooth. Most of this stuff for temporary crowns usually has a shrinking factor or a exothermic reaction where it'll heat up and shrink, and we don't want it to shrink or adhere to the tooth. So we're going to use a little bit of petroleum jelly for our Typodont models. A good separator for actual patients may be used, such as saliva, a little bit of water, or any type of lubricant that will help will be allowed in the oral cavity. So for this, I'm just going to get a little bit of petroleum jelly, and I'm just going to smear it onto the tooth. I don't want there to be a lot of caked up areas that I can visibly see onto the tooth. Put it onto the teeth that are right next to it so that the material doesn't adhere to those teeth as well. It'll be easier for removal. And take a look at what you placed on there and remove any bulk that may be there. Another useful thing to do is to get a cotton 2x2, and like floss, you can run the cotton 2x2 in between the teeth to remove any excess material that may have been used. So using a 2x2, you can always fold it like floss and gently rub it off of the tooth and verify that nothing in bulk has been left behind. You don't want to interact too hard with the gingiva. Usually in a crown preparation setting, there may have been some irritation, or the burr from the handpiece may have rubbed against the gingiva, and it may be it may want to bleed a lot easier. Once we have our separator placed on there, we're going to grab our impression that we took earlier for our preliminary, and you're going to identify how it fits onto that person before we start fumbling around with it with the material inside. Find your buccal, find your lingual, place it onto the tooth, ensure that it fits. Once we have that, we move over to the next step. Now, the important part when it comes to actually using our preliminary impression and our temporary material is that when we place it into the tooth, that we backfill it. We want to make sure that our tip, when we are placing it into, or placing material into our tooth, that the tip stays submerged or underneath the material that you're pushing out. You don't want to pull out the tip and put it back in, or else you'll possibly introduce air bubbles. So I'm going to pull on my trigger and I'm going to slowly fill in. You'll see that the tip filled up, and I'm going to slowly fill it up. And as it fills up, I'm going to slowly pull. And now that I have my number 8 filled up, I'm going to go and place it onto my tooth. Make sure that it seats all the way down. And a nice smart thing is to take some of your material that you have and do a little dot on your glove. And the reason why you'll use that is to identify when your material has set, and you can take the impression and the temporary crown off of the tooth. Some of them have a faster setting time than others. It's usually nicer to play around with the material so you can be familiar with it when time comes to be with the patient. So I have a little dot of material that I can watch and monitor while the material inside the patient's mouth is setting up. Now, as I said before, many materials, when they are placed into the mouth, they set up quicker because the patient's oral cavity is a lot more warmer than the ambient air that's in the laboratory or in the dental op. When I look over here on the sides with my mouth mirror, I'm identifying to see if there's any excess that's being pushed out from when I placed the impression with the temporary material. And I do see some that is left behind, but you don't want to take it off immediately. You want to still leave it there and let it harden up a little bit so that you don't smear it when you're using an instrument to take it off. I just have a mouth mirror here and a basic setup. So if I have my Explorer and I go to push at that material, it's starting to firm up, so I'm able to find out that this is on its way. If I go and test my test material, it's also starting to firm up, creating more of a uniform shape to itself. It holds its shape, it doesn't droop or leak or spread anywhere. So my material should be almost done. If it was in the mouth, it'd probably be done by now. So now that it's firmed up, I can use my Explorer to remove that excess right now because it has firmed up. We never want to remove excess cement or material too early, at risk that we smear it everywhere, making a bigger cleaning that we have to do when we're done. I pulled this part out, it was set up, and it went everywhere from the front to the back of the tooth and created a nice little tooth-like V shape. This material should be done just about now, so I'm going to gently take off my impression, and sometimes it may come out in the impression, sometimes it may be left on the tooth. In this situation, it is left on the tooth. If you're using a material that has shrinking properties, you don't want it to shrink onto the tooth. You want to see it and take it off of the tooth gently as fast as you can, so that it doesn't become a problem that it shrinks onto the tooth. I'm just going to gently go from the cervical portion and pull out on the excess that we have. And now I have my temporary crown. Now, once you pull it off, you want to reinsert it the correct way that it went in, or the correct way that it was on, so that it can remove any other undercuts that may have been produced by that tooth being prepared. So taking it off and then putting it back on is a smart way of removing any undercuts and avoiding a crown to be locked onto the tooth. So removal, place it back on. And the main things that I'm looking for when I'm checking to see is if this crown was correctly made is, does it match the natural path or straight path that this tooth has, or if it's a lateral, is it properly lined up to the other lateral tooth? Because some laterals are going to be more sunken in towards the gums and be more receded than the central tooth. So you're going to be there with your patient, taking the crown on and off, and you're going to be taking a look when it's finally finished at your crown that you have. And you're going to be marking some places, or you're going to be trimming some places where some trimming needs to happen at the margins of the crown. So looking at my crown, let me focus. I have a little extra right here off to the side that I want to take care of. So I'm going to have to trim that, trim a little bit right here, but I don't want to trim into the margin where I'll have an exposed tooth surface if I trim too deep. Overall, the impression looks great. It made a real nice representation of the tooth, and we'll go on to trimming our temporary crown, seating it on our tooth to verify everything's there, and getting that properly cemented. Before you want to make the patient leave because the appointment is over, you're going to want to check the adjacent teeth and make sure that there's no flash left over on those teeth. Now, flash is just referring to the extra material that can be left onto the teeth. Usually can happen on temporary crowns or composite restorations, and we want to remove those and make sure that it's not left behind. So a lot of times that may be in the sulcus, and you may need to do some removal with your Explorer. A good other instrument to use is a plastic instrument. It does not have any sharp points, so it's a little bit better at safely removing flash. And you'll be surprised where that flash material gets left behind, and if it's tooth colored, how well that it's hidden. The patients will usually feel it, and they'll feel a rough spot. So with my plastic, it's a lot more rigid, doesn't bend as much as my Explorer does. I'm going to go and rub along that tooth and the adjacent teeth to get all that flash removed from the sulcus area, from the interproximals, from the lingual, if it's left behind. You'll be able to feel it when you run your instrument over it, and you'll have little flakes left behind. The patient's tongue will immediately feel it when they run their tongue along their teeth. So you want to get that taken care of before you have them leave. Good. Once you have that nice and cleared up, there was a hidden one right there on the distal aspect of that tooth. Once you have that cleared up, let's go and move on to trimming our tooth. All right, so now going into this next part, we're going to go into trimming our provisional crown. We have a little bit of excess that's falling around the margins, maybe a little bit in the interproximal area, so we're going to go to trim those. Using your slow speed handpiece and a laboratory burr or acrylic burr with your choice of acrylic burr head. There's many different types that you could possibly find in your offices, or you may end up wanting to use a disc to polish up to trim up your models or your temporary crowns. It's all whichever preference you like. I'm just going to use this one. It's more of a pear-shaped burr, using a nice steady flow and a good firm grip onto your crown. You're going to identify the areas that you're going to trim away. It's always good to hold this in a nice palm firm grasp, and using your thumb to stabilize against your other hand that's holding it, you can do pulling strokes to trim away any of the margins or excess that you're going to be wanting to use. Now, a real useful tool for marking areas that you don't want to go past is to get a pencil and find the margin of your tooth right through the portion where it seats onto your tooth. And when you have that margin and you mark it, you should use that to identify that you are not to go past any of these parts. You're just going to trim all the areas on the outside. And once I have that marking made, I know that I'm going to just trim everything on the outside, but always double check what you're doing. Don't go too far, don't cut too much. Also, a good thing to identify is right in the interproximal portion that you're not cutting into the part that makes your contact. So making a nice visible indicator to show that this is a part that I'm not supposed to cut into, just cut around the outside parts, is a good heads up. So palm grasp, thumb out, stabilize it against your other hand, and identify where you're going to cut. I'm going to start with this interproximal portion. I'm going to do a pulling stroke, gentle pull, and I'm going to trim off the excess that's on that facial aspect of this crown. I'm going to rotate it. I'm going to do the lingual aspect of it. Gentle, a little bit at a time. You don't want to go too crazy with it. You don't want to over trim. Right now I'm just trimming up my contact areas so I don't have these extra larger wings that stick out and look unnatural to the tooth. I'm going to go to my other side, do a little bit of trimming, a little bit of contouring, watching out for my markings that I made so that I don't dig into them and ruin my contact, because contacts are very important for temporary crowns. I'm going to look top down to the margins of my temporary crown, and I'm going to identify the different parts that I want to remove. So I have these larger wings on the outside, so identifying them, pulling strokes, I'm going to gently and slowly remove that away, just so I don't have any plus areas. And still getting a nice contour. Right now I'm using a electric slow speed, so my control is pretty easy, but if you're using a slow speed at the rheostats and the operatories, have some practice with them so you can keep the speed adjusted. I'm going to try this that I just trimmed up into my mouth, and I'm going to specifically look at areas such as my margins. I'm going to look at my facial margin, I'm going to look at my lingual margin to make sure I didn't cut too deep into them. You don't want to see an open area where you have a space between the tooth and the crown. If you do, you're going to have a problem with tooth sensitivity, because there's saliva, bacteria, any type of thermal drinks are going to go in there and interact with either the live nerve endings of the tooth, potentially creating pain, or if it has been a endodontically treated tooth or the tooth is not vital, you may have bacterial growth happening inside the tooth where a person cannot get inside there to properly clean the tooth and brush it to remove that bacteria. So it's really important to make sure that your margins are flush from the tooth to your temporary crown. You can feel it by taking your Explorer and gently running it from the tooth to your temporary crown. It should be a nice smooth transition. There shouldn't be any there should not be any dug out places where your Explorer will fall into and you'll have to pick it back up like a canyon. And there shouldn't be any large humps or hills where you have to go over a specific part to get to one spot or the other. Do it for both sides, for the lingual and the facial. And once you have found out that you are good on all those aspects, move over to the next spot. Next, we're going to go over into checking our contact with our dental floss. Now, you want to make sure that when you are checking the contact, that you're holding down the crown as if it was cemented with whichever cement that's going to be used. You don't want to floss the temporary crown when it's not seated fully, because that slight movement of placing the floss in might make the temporary shift. Or if you pull out, you might unlock that temporary and have it edge over or move over a little bit so that you don't have a proper contact. So firm force down onto the tooth, get your floss ready, and it's nice to either use one finger to secure and hold down the tooth while the other two fingers try out your contact. Using one finger and the other two fingers to check. You should have a nice snap or nice hard contact between your natural tooth and your temporary tooth to, for one, keep the food from going in between the teeth and causing a food impaction, and two, if you have a really nice firm contact, it's going to hold those teeth that are naturally right next to it in their positions, because teeth love to scoot over if they have the room to open spaces, and we don't want any changes in our teeth positioning, because we just sent a final impression out to the laboratory and they have a guide on how the teeth are naturally in their position. So you don't want to have any alters or any changes of that. If you have a really open contact where there's no snap of the floss or there's no resistance when you're trying to floss in between, the teeth will move over a slight bit to close up that spot. So we want to make sure that we have everything sealed, there's proper contact, and also a real important one is to check the occlusion. Alright, so checking the occlusion is a really important part, because if you have a temporary crown that hits too early onto the other teeth, potentially you're going to either, one, break the temporary crown, or you're going to have an injured PDL or injured periodontal ligament from overpressure on that tooth when it occludes. So taking my bite paper, I just have a blue bite paper, I'm going to have that tooth pushed down seated as much as possible. Usually this is going to happen before cementation, and you're going to place it right on the occlusal surface and you're going to have that patient bite down. bite down normally. A little tapping is fine. You can just tap, 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 tap. And you're going to go and check that crown to see if there's any occlusal marks made. So I go and look and I check my lingual surface where I have one small blue mark that I'm going to trim away so I don't have any occlusion on that crown. Very important that I don't see any markings when I send this patient out. Most common thing that's going to happen, they're just going to break their crown. And that's going to have it so they're going to have to come back in and waste the space or time frame where we could have had another patient. I removed a little bit. I'm going to insert it right back on my tooth. I'm going to tell my patient, I'm going to have you bite down, tap, tap, tap. Don't be gentle because that patient's going to bite down to smash food. So you want to make sure that they have a firm occlusion when they go and tap on that material. So I tapped on that and it's not showing any blue marks. I see a hint of a blue mark right over here on the distal aspect of that lingual portion. So I'm just going to do a little bit more trimming. Just a slight little glide over everything. I'm just going to trim it just very slightly. Place it back in the mouth. We're going to try it again. Okay, I'm going to have you tap your teeth together, do a firm occlusion. Take a look, and I'm pretty good on my occlusion. There should either be no marks or very, very light in general. So I'm going to do a little bit right here at the incisal edge. Apart from that, I'm going to leave it the same, and this is what's going to be my end result for my patient. Now, the main important thing about these temporary crowns is you don't want to make them too pretty. Because if you make them really nice looking, I've had it where patients actually said, well, I already have the temporary crown, so I'm just going to hold on to it, and that will be my permanent from now on. Mistakenly, when they do that, eventually it will break or it will come off. It will be sometime after. I've had a person where they came 3 months after we've already had their final crown ready for them. And after 3 months, that temporary finally came off. They come back in wanting their final crown. But at that point, she wore into this temporary crown so much that the teeth around it started to form or make contact with that temporary crown. So the teeth shifted a little bit. They moved over and scooted over a little bit. And if we were to try and that final crown in there, there's probably about like a 75% chance that it's not going to fit in there without having to grind the new crown that we just got and having it be not as the laboratory has given to us. So it's important to make sure that the patient knows you're only going to have it for about 2 weeks or so, and then we're going to get this final crown cemented into place. So don't make it too pretty, too flashy. It's nice if you, especially if you know the patient works with like public figure or they're a speaker or anything like that. They might want to have a little bit more polished up, which you can use a rag wheel on a dental lathe, or you can use a rag wheel on a slow speed handpiece with a little bit of pumice to just give it a little bit of a polish and a natural shine to it. That could be completely fine. Another thing that I've had done where dentists would put a small amount of composite right over the facial aspect of the crown, giving with the specific color to their other natural teeth, and that will give it a nice shine and a nice color match to the other teeth so that it looks a little bit more prettier for them. Next on that we're going to go to is cementing the crown with a temporary cement. All right, going into our temporary cement for our temporary crown, you have a couple options of being able to use either a ZOE and IRM version for temporary cement, or you can use a temporary cement that's such as RelyX or Temp Bond to be able to do it, and that is eugenol free for places where you might not want to use a eugenol based cement, but it's going to be temporary, so about 2 to 3 weeks or so until we get the final restoration, the final crown in. Using a temporary cement such as this is pretty good for if you're anticipating that 2 to 3 week time. If you know that you have to have it for an extended amount of time, such as if someone's going out on a trip, or they might have informed us that they're not going to be back in a specific amount of time, we might want to use something that's stronger, such as IRM, that will make a better hold when we are going to do our temporary cement, and we want it to last a little bit longer. It's also got the eugenol for soothing properties in case there's a lot of sensitivity with that tooth. So we're going to make our choice for which we're going to be using, which today we're just going to be mixing a temp bond or temporary cement mixture. All right, so now that we have our materials ready, we know we're going to use what type of temporary cement to mix. And I have a 2x2, I have my temporary crown that I made. I have a couple instruments such as a spatula and a plastic instrument for mixing or placing. And I'm going to start laying out how much I need. Now, with anything that's a 2-tube system, more than likely it's going to be a base and a catalyst. So you want to make sure that you grab such. So this one's a catalyst. See, catalyst. And the other one is a base material. So I'm going to put out a little bit in equal amounts. So I'm just going to do a dollop right there. I'm going to put the correct cap back on there so that it doesn't leak out or evaporate, as we should always do. And then we're going to extrude the same amount in the base, or whatever the manufacturer's instructions may be. Some of them say equal length, some of them say equal amounts. So always read the manufacturer's instructions. Taking that and my spatula, I'm just going to go and mix that together in just a moment. Make sure that the tooth that you're working on, depending on what material you're going to be using, is either dried up well. So you might have to place some cotton rolls in the vestibule or along the lingual side or anything, just to make sure it's dry enough when you get this into the tooth, because sometimes you don't have that much time before it sets. So I'm just going to usually gather it, and I'm just going to smear it until it goes into a homogeneous color. Once you get that mixed and you have a large amount of it over a large area, it's nice just to scrape along the whole portion of the pad until you get a good dollop that's ready to be used and placed. You could use the whole dollop and just scoop that up and place it directly into your crown. If you need to be a little bit more precise with where you're placing, you can use a plastic instrument and scoop up just what you need. Say if I just wanted to line the walls of my temporary crown and I just need a little bit, I didn't need the whole amount, I could always do that. But if I had the whole thing, I could just go and fill it up completely, make sure that it's filled up. And it's always important to wipe your instruments early so that it's not a harder cleanup later. Once I have that material, I'm ready to go to my tooth to cement. So we're going to go and transfer over to here, where I'm going to have my material, my tooth. I'm going to identify which is my facial, which is my lingual. So placing that, it's going to be placed on there, firm pressure, and you'll see that there's going to be excess that comes out and goes into the sulcus or around the tooth. You want to have nice firm pressure. At this point, you could have a cotton roll that can be placed on the opposite tooth, or a rolled up 2x2, and you can have the patient gently bite down, securing that temporary crown. It's nice if you have that biting force there, not too hard, but enough. And you might be able to hear any air voids or bubbles that were left inside that mix just come right out through the margins. But you want to have it there until the mixture sets up. Depending on what type or what material you use, the setting time will be different, and also depending on the temperature in the room or the temperature where you're at geographically might determine how long something may need to set. So, but as we said before, if it's in the patient's mouth, it's usually going to set up faster than it would as what we have over here left on our mixing pad. Now we wait. We don't want to remove it right now. We want to remove it when it has firmed up. So just checking it a little bit with my Explorer. I'm just going to tap on it and see if it's firmed up, and it's starting to firm up. We don't want to move it and remove it too early because we'd potentially smear it. But when it starts to firm up like it is doing, then we'll be able to get a nice pull when we go to remove. So I'm just on one side, and I'm gently pulling, and I'm getting a single cement removal pull if I can. So I'm going to take that part off. Just go wipe it onto my 2x2 or onto the patient's bib, whichever is available. I'm going to go over here. I'm going to gently go and pull that off. Get that clean. It's not all about the facial. We also have to go on the lingual aspect and remove what's left behind there. So I'm just going to check what I got going on here in the lingual. And I'm going to gently move it. The best way to do it is to push it towards the gingiva so that you don't risk possibly lifting up the crown when you go to do your cement removal if the cement has not set up just yet. So once you have all that material nice and removed, we need to check our interproximal portions. So when we get to the part when we're going to floss our tooth to remove any excess cement from in there, it's nice if you can just use a regular floss, but a good way to get all the extra bits that are hiding in there is to create a knot in your floss. You create a nice little floss knot, and with that, when you go to floss in between the teeth, the knot will go in there and drag and knock off any pieces that are stuck in between the teeth. Alright, so from here we're just going to take our floss that we placed the knot in there. Sometimes it gets hidden, so just drag your finger along until you feel that knot. You're going to go right in between the teeth with still holding a pressure down on the tooth so that it doesn't unseat. And you're going to take that knot and you're going to pass it right into the interproximal, right where that sulcus is. And you can rub right into there and knock off any excess cement that may be hidden in that spot. Every time you floss for this temporary tooth or with a final tooth that just got freshly cemented, you want to take out, or you want to hold on to that tooth so it doesn't fall out or get displaced. Take that floss knot, pass it right into the sulcus, knock out anything that's left behind. So right now I'm feeling an obstruction. It's good that I have that in there. Good. Alright. Once we have that tooth nice and excess is removed and it's placed in there, make sure your patient can comfortably bite down on it, that there's no obstructions, there's no extra flash left behind. Remember, the flash is from excess material of the temporary or the composite that can be left behind that will adhere to the tooth. It's nice to use a composite instrument or a plastic to go and remove anything that may be left behind. And just check. See that the patient likes it. Make sure that they visibly can see it with their mirror, especially if it's an anterior tooth and they okay, that's fine. Ensure them this is only for 2 weeks. This is not a forever restoration. When the real thing comes in, it will look a lot more lifelike and it will match your teeth color more evenly. And that's where usually we'd stop at it. The patient's going to go out You're going to inform them not to chew any chewy foods. Avoid it, even if it's a front tooth like that. Tell them to go and bite down more on the left side or the right side to avoid putting any pressure or any lateral movement, so side to side movement, because those are easy ways to be able to take a tooth off. If they're a bruxer or someone that clenches their teeth, they're going to overly put pressure on these crowns and potentially can crack them. Or if it's an anterior tooth, you might have a little bit of a clencher that pushes the tooth and it will push it forward, which is an unnatural motion for it to be receiving pressure from, and it might knock the temporary off and need a re-cementation.